What lesser-known preventative medical test screenings procedures should people in their 20s or 30s get? People have this misconception that a chiropractor is only for older people with back issues. In reality, you probably should be going twice a year for a readjustment or even 4 times a year once you hit age 25-30ish. Just as a preventive measure to keep your spine aligned. It's always out of place and can cause other issues all the way down your body like hip or foot pain. If the spine is misaligned, everything else will kind of adjust accordingly and cause discomfort or even pain in other areas of your body. Check for factor V Leiden thrombophilia before you go on birth control. I got tested at 22 because my dad had a DVT when I was in elementary school and tested positive. I haven't had any problems yet, knock on wood, but now it's in my medical record in case anything happens to me. It's in my phone's medical alert app. It's in the medical alert app on my Fitbit watch. And I was able to pick a safer birth control because I already knew that many of them would not be. Definitely get a skin cancer screening. No one thought that I would have anything, but I went just to get checked a few days after I turned 21. Now I'm halfway to 23, and I will have to go every 6 months for the rest of my life. I have gotten 4 stage 2 melanomas removed since that first appointment. This is the first time since then that I'm cancer-free and I no longer feel sick all the time. 2030? Get an annual physical which should come with some labs. CBC, thyroid functions checks and a CMP. Honestly, exercise, eat right and take care of your teeth. Get a solid 45 minutes of cardio a day where you get your heart rate up around 80 max. Take care of your body. Do not eat and drink loads of crap. Fast food is cool, once a week or so, but not every damn day. 1. Vitamin D levels test. 2. Thyroid function test. 3. Lipid panel for cholesterol. 4. Blood pressure monitoring. 5. Skin cancer screening. 6. Exam for early detection of issues. 7. Bone density scan for osteoporosis risk. 8. Sexually transmitted infection STI screening. 9. Dental checkups for oral health. 10. Diabetes risk assessment. Get your eyes checked. Your eyes have a ton of incredibly sensitive blood vessels and will give you a good indicator of your overall health. These are some medical conditions you can detect with an eye exam: diabetes, high blood pressure, lupus, cancer, MS, and impending heart attacks. Get your shit checked. Vitamin D screening, especially for women who want to become pregnant. Clinical research is still lacking a bit, but there is some evidence that vitamin D deficiency in pregnancy can increase the likelihood of autism in the child. Pretty much all Americans who are not taking a supplement are deficient as well. Not a test that you get, but a freebie you can do yourself. Get to know your boobs or your balls. You do not need to be old to get cancer. The earlier you catch a difference to what's normal for you in those areas, the better your odds of getting through it relatively well. B12 and other vitamin levels. I had an undiagnosed B12 deficiency that has resulted in permanent nerve damage and chronic pain. I'm only 43, and if I could go back and check on this very simple, solvable problem, my quality of life would be much better. MD STI screening including HIV, chlamydia and syphilis can hide with only subtle symptoms. Have seen at least a few positive cases where there's no history consistent high risk. Even if you're monogamous, don't risk it. Gum, dental and mouth health. Serious. It's not just teeth. My best friend had some serious cancer crap in his throat. Caught it early because of a silly sore throat. It wasn't just a cold. Had no clue. Saved his life. Kinda not funny seeing some people be like, talk to your doctor about this instead, as if doctors are well known for taking patients' concerns seriously. DNA malformation checks, at least for methylation. When your body doesn't process B12 properly, every day feels like running on fumes. I go with an iron panel. It's not normally tested, but my brother just found out he has hemochromatosis at 31. Take your teeth seriously. Get in good food and exercise habits now. Your mid-30s are rough, smiley face. Use condoms. More also 30s. A calcium score test. It checks for clogged arteries. Much better if you catch it early. Colonoscopies. If I had to get one due to family history, then why you assholes should too. Look up the USSF. It is where we doctors get the tests that we encourage you to do. Go to a dermatologist for a full body screen check. Sun damage is real. Get screenings and immunizations for sexually transmitted infections. Lol top promoted comment. Get the real deal on fentanyl. Get the HPV vaccine. The younger, the better men and women.